It's so great being part of this healthcare team. When your GPs are working next door and your nurses are on the other side of you, you can make things happen.
Deborah Hawthorne is a passionate pharmacist who loves nothing more than to promote the exciting possibilities open to clinical pharmacists. An inaugural member of the medication review research group Coherent, she has also been active in the creation of embedded pharmacists within the disability space, and actively tries to lessen the healthcare gap felt by rural Australians in her area.
Being an embedded pharmacist is very new. I think I'm probably the first and only GP pharmacist in my local area. My role was created in 2019. My entire workplace is extremely welcoming of pharmacists. They love being able to knock on the door and ask a quick medicine question, or get me in on a consult with a patient, or do a multidisciplinary case conference in the tea room where we can all really nut out what a patient's issues are and how we can best support them from a nursing perspective and a medical perspective and a pharmacy perspective. My current work involves me going out and visiting people in their homes and reviewing their medicines. Being an embedded pharmacist plus a consultant pharmacist, there really are so many benefits. I get to follow them up in the clinic, in their home. It's this ongoing process. It's completing this patient cycle of care that we all talk about. The start of the pandemic, I was a sole pharmacist, not working with any other pharmacists, and feeling quite lost. I was actually at home, and I was looking after my twins, and they'd fallen asleep on either side of me, and I had my computer there, and I started this Facebook group, and overnight we had about 200 or 300 pharmacists join from all over Australia who were consultant pharmacists who do medication reviews or are embedded. And now almost, just over 2 years later, we're almost up to 2,000 members, so it's a very active group. I've also started a few other smaller groups, like one for my local area to help support our local pharmacy needs. I've also created a Victorian GP pharmacist network as well. I've found that my practice and hopefully patient outcomes have vastly improved since I started reaching out and asking for help and talking to people, just communicating and finding out what others do, because you only know what you know. We don't just have those three options of industry, community and hospital. We are expanding our scope every day. We're vaccinating, we're getting out to patients' homes, we're getting ourselves embedded in all these places where medications are and where we should be. The pharmacy profession is only improving, I think, because we have more involvement in more areas and we can help more people in the process.
Congratulations, Deborah Hawthorne, 2022 Early Career Pharmacist of the Year.